I'm Dr. Miner. Today we're going to do a smile design and enhancement with a patient. And what are the things you're hoping to accomplish?
Well, I had these crowns done like 30 some years ago, and I don't like the way they look. I want to get rid of the metal edges, and I want my crowns to look more feminine.
More feminine. Okay. So a couple of the things that we're going to do to accomplish that is we're going to reshape our gumline, and to help create that feminine look, our gumline's kind of going flat across, and we're going to create kind of some arches to it. And we're going to take out the metal, so we're going to take these crowns off. We're going to do all metal crown or all porcelain crowns, and create these crowns with a very nice feminine look. All right, so one of the things we have, and we're going to use, is a proportion gauge, and we can put this on the tooth, and that's going to be a guide for us to get the proper proportion. So between the width and the length of the tooth, to get a really nice look. So the other thing we have is a guide of how we want to trim the tissue, which we made this on a model, and we're going to put this in. We can trace this. We're going to use the laser to contour the gums, and we probably need to do a little bit with the bone, which is, with the laser, is a very nice way to do this. A lot faster healing, a lot less discomfort than the traditional or old-fashioned way, which takes many weeks to heal up from. And she'll probably have a little tenderness for a couple of days, and that's about it. So here's the neat thing of doing this with the laser is, we've trimmed the gum here. I've also gone in and removed the bone, and with removing the bone, I have a little mark on the tip there, and we can go in very subtly right to that mark, and that tells us we're at the right distance. And this is minimally invasive as compared to the old-fashioned way, which is make an incision all across here, pull the gum tissue back, and then trim the bone. So a lot more painful. The old-fashioned way, with this, the gum tissue is going to stay like that. Go in, trim that. Going to have a great result, and probably only be tender for a couple days. All right, so we got the gums shaped, and we got the temporaries on. And one thing that's a little unique with this patient is she does not have the canines, which are the side teeth over here. And so one of our goals is to make her smile look more natural by creating the shape of a canine on the tooth over here. And so with getting the gums trimmed and trimming the bone, did that with the laser, what were your thoughts? How did that go for you?
I thought it was great. I barely noticed when you were doing it, and there was no bleeding, and I can hardly tell that my gums look like anything was done to them. I mean, I can see the shape of the tooth has changed, but as far as redness and everything, I can hardly see anything. So.
Okay. Great. So this is she might be sore for a couple days. That's really about it. Yeah, minimal bleeding, minimal soreness as compared to the traditional way. And so we got the temporaries on. What do you think of those?
I think they look a lot better. I love looking in the mirror and not seeing those metal edges that I saw before. So it looks great. I think it's taken 20 years off me.
All right. So we got a good start here. We will continue when we get the final crowns back and get them on. And we'll go from there. Alright, so we got all the crowns and veneers on. Went pretty smooth. And from your standpoint, what do you think so far?
I think it looks great. It's so nice to look in my mouth and not see metal edges, to see nice pink gums, and also to see the nice arch on the teeth now.
Yeah, good. So when we did that gum surgery, how sore were you afterwards?
I wasn't really sore at all, just maybe a little tender for 2 or 3 days.
2 or 3 days? Okay.
But that's all.
Okay. And you had told me previously that you'd went to another dentist for a second opinion, and they wanted to put you out.
Yes.
Is that right?
Uh-huh.
So what are your thoughts now that you've gone through it about that?
I don't think you have to be put out at all. I mean, really, it took a while to do the gum surgery and everything, but it wasn't really painful or anything. I think you can do it fine with just regular anesthesia. And today, when you put the crowns on, I didn't have anything.
Yeah.
So.
Okay. Good. So now that we're all done, looking back, would you do it again?
Absolutely. I know it took me a long while to get to this point, but yes, I would do it again.
Okay.
Yeah.
All right. Well, thanks.
Uh-huh.